We're all aware of the scary headlines. Mosquitoes capable of carrying the Zika virus found in Windsor, Ontario. 2 dead from West Nile virus. Ticks taking the risk of Lyme disease further north than ever before. Disease-carrying pests are certainly not new to the province, but is something new going on to bring about this dire news now? Joining us now for a look, Ian Crandall. He is research scientist and assistant professor in microbiology at the University of Toronto. Fiona Hunter, professor of biological sciences at Brock University in St. Catharines, and Curtis Russell, senior program specialist at Public Health Ontario. And it's great to have you all on our set today for a very, unfortunately, timely discussion. Fiona, I want to start with you because I want to start by getting a better understanding of what the effect of climate change is on Ontario's disease-carrying insects. What do you think?
Well, I've been working at Brock University for 24 years, and over that time period, we have seen at least 10 new to Ontario biting insects and arthropods, such as ticks, move into Ontario.
What do you attribute that to?
The range expansions that we can only attribute to climate change, that now it's more hospitable for these insects and arthropods to actually be living here. And previously, they could only live further south. So, yeah, in my lifetime, we've seen these species move north.
So while some people might like the warmer weather in wintertime, there's a downside to it.
Oh, there's a huge downside because we're not actually stopping those populations.
Ian, tell us about mosquito behavior and how they have somehow figured out how to adapt to the changing conditions here.
Well, mosquitoes are very adaptable. The point is that they're around. When things get a bit warmer, you get them speeding up a little bit so that there are more breeding seasons, you get more disease. They also are selected for a huge number so that, for instance, it's been known that if you start laying traps for them in a certain way, you'll kill all the ones that didn't figure out the trap, but the ones that did will survive. So you constantly have to sort of worry about what mosquitoes are doing, how are they going to get access to people.
And they manage to stay a step ahead of us, it seems.
Well, a huge number of them, relatively few of us, so that every time we try something, they have a counter move.
More life cycles per summer?
Yeah, the way it works is that as warm-blooded people, we don't notice temperature. But if you're cold-blooded, if it's a little bit warmer, it means that you develop a little bit faster, and the mosquitoes you're in develop a little bit faster, so that by the end of the summer, you just have that many more mosquitoes and that many more pathogens, so that a little change in temperature can cause a huge change in the number of cases that we'll see. And
thus your chances of getting bit are higher.
Yes. Well, also, if it's nice outdoors, you go and sit in the lovely outdoors with the mosquitoes.
Yes, indeed. Okay, Curtis, let's talk about Lyme disease, because I think when I was a kid, we never heard about Lyme disease, and now you hear about it all the time. Why has that changed?
So same thing too with the temperature increase. The cold doesn't really, it's called the black-legged tick or the deer tick. That's the one responsible for Lyme disease in Ontario. And so the cold doesn't really kill the tick, but again, like with the mosquitoes, it slows them down so they can't get through their life cycle. So with the warmer temperatures, they can get into those habitats that are good for them, the brushy wooded areas, and they can get established, and then they can expand and thrive in those environments. But that's what we're seeing in Ontario. We're seeing more pockets of those ticks and expansions of those pockets into parts of Ontario.
There was some speculation that we were going to see record high numbers of West Nile this year. Did it happen?
I don't think we've seen the end of West Nile yet. We've got people would have been bitten a couple of weeks ago when we were at the peak number of positive mosquito pools. Many of those people will just be getting sick now, and their results to confirm whether or not they've had West Nile won't come in for another couple of weeks. So I think the numbers are still increasing.
How would you make a prediction in the first place as to how bad or good a summer would be?
Our prediction model was based on 15 years worth of data for mosquito surveillance in Ontario. And we ran the data. It took us over a year to run all the statistical tests, backwards, forwards, upside down, until we actually came up with a model that if we took data out and ran the model and then put that data back in, were we actually seeing the same trends over and over again?
And you don't think we've heard the last of it, though?
I don't think we've seen the last of it for this year.
A couple deaths already, eh?
Apparently.
Yeah. Ian, let's talk about malaria. Malaria in the province of Ontario?
Oh, we have a long history. Used to be that Hamilton region was a hot spot. When they went to build the Rideau Canal, at some points they had to stop because people were dying from malaria.
Okay, but that's ages ago.
Yeah, yes. But The point was, since we're cooler climate, it was easier to push malaria out by controlling the mosquitoes a little bit and treating people. And they managed to do that essentially down to the US. So the CDC in Atlanta was set up to get rid of malaria. They did that correctly, and now they're on to phase 2. But the point was, malaria used to be essentially pole to pole. And if it's cool as it was, you can push it out and it stays out. The problem is if it warms up, it makes the job much harder, and after a while you fail, and malaria is back in North America.
Are you forecasting a return to malarial conditions in the province of Ontario?
In certain groups, yes. The point is most people now live in nice air-conditioned homes with screens, and the mosquito that spreads malaria is a night biter, so relatively low. But if you're at a cottage or an environment where you have much more contact with insects, if malaria comes back in, it's possible it will stay. And we have imported malaria sort of seeding the province, so it's quite possible that we will get malaria endemic in Ontario again.
Fiona, do we now have mosquitoes in the province of Ontario which we had previously thought were tropical?
Yeah, we've got 2 major species that have just showed up in Toronto, basically down in Windsor area, that shouldn't be here at all. One of them's called the Asian tiger mosquito. We sort of predicted that that would come. I thought we would see that in my lifetime because it had slowly been working its way northward in the United States. But the second one, called Aedes aegypti, which is the one that everybody hears about with respect to Zika and yellow fever, I never thought that that would show up here.
And
because
yet here it is.
Here it is.
What can you get if you get bit by one of these things?
Well, fortunately, you're not going to get yellow fever or Zika because that requires that there are also people living here with yellow fever and Zika. So just because the mosquito's here doesn't mean you're actually going to get sick from it. It's looking down the line to see what other new emerging diseases might come along, and these species have been shown to be really good vectors of viral diseases of humans.
What does that mean? Good vectors
Oh,
of it?
good vector meaning that they're able to transmit from person to person. And so if we were to get new emerging infectious diseases that are transmitted person to person via mosquito bite, then they may be candidates. But right now, there's no risk because we don't have people walking around with Zika or yellow fever.
We don't have a lot of those mosquitoes yet. Like we're working with Windsor, Fiona, Ministry of Health and Public Health Agency of Canada. We're actually doing extra surveillance for those mosquitoes to see where they are in Windsor and see, how did they get here, what's bringing them in. And we also talk with our colleagues in Ohio and Michigan because they're looking for those mosquitoes too to see. So Michigan, they just released that they found a couple of those albopictus mosquitoes in the Wayne County, Detroit area. So they're kind of seeing them in this general vicinity.
How did they end up here in the first place?
Still a guess, but a lot of things is, a lot of the research shows that they can be moved by transportation. So Windsor's a big transportation hub for Canada. So through containers, trucks, shipping, that could be a way to move them up very quickly. And then just you have the right climatic conditions for them to stay here.
Well, you've got the floor. Tell me about Lyme disease again. Let's return to that. What's happening with caseload, for example?
So we are seeing a steady increase in cases across the province. So in general, we are having more cases. We're just over 400 cases for this year, which is on par with what we had for a total of last year. Again, the big problem risk areas are in those brushy, wooded areas. And the areas we see mainly are along the north shores of Lake Erie, Lake Ontario, St. Lawrence River. And we even do have risk areas, which is where the ticks are established and occurring, even in the Toronto area, like they're in the Rouge Valley system of Toronto. So
you had 400 cases all of last year. You got 400 cases in only 9 months of this year. Mm-hmm. So you're can we handle the uptick that's coming?
So we are anticipating.
No pun intended, sorry. Yeah.
So we are anticipating more cases. A big thing with that too is, we have more ticks, more positive ticks, but people are knowing about it a bit more now too, right? So, if you are concerned, if you have exposure to ticks, go see your physician, request testing. So there's also that anecdotal evidence that we are seeing more people know about it as well.
And Ian, let's just nail this down. Zika, dengue, yellow fever, do you anticipate we're going to start to see numbers of this kind of thing?
Yeah, 2 issues involved. There's the mosquito population locally. And if you have the correct mosquito population, you then need travel, and who hasn't been on an airliner in the past, let's say, 2 years. So part of it is that also if you look at the population of Canada, we're getting more interesting new Canadians. Instead of being from Europe, they tend to be from Asia, Indian subcontinent. So that we have populations in Canada which are kind of interesting. They go and visit the old country, and then they bring interesting diseases back into Toronto. So it keeps us on our toes.
You call it interesting. I can think of another adjective that other people might use.
I have friends who are tropical disease specialists, so for them it's
It's all very exotic and interesting.
well, and a good source of income.
Your mission, obviously, with Public Health Ontario is A, to make sure people don't get these problems, but if they do, what we can do about it. Want to give us some advice?
So big things for local mosquitoes is not to get bitten ticks. So, wear repellent, usually containing DEET, follow the label, and then wear light colored clothing. Because if you're talking about ticks, they have to crawl up. You can kind of get on your skin. So everything tucked in, light colored clothing, you have a better chance of noticing them. We have this thing we joke about, but we call it the buddy system. If you go home after you've been out in the woods, take all your clothes off and have someone help check you for ticks to see if there's any on you. So I'll let you define what your buddy is, but that's kind of the idea of
It
what.
sounds very romantic, whatever it is.
There's actually a country song where it says, I want to take you home and check you for ticks. So that's the main thing. And then with mosquitoes, especially in Ontario, the ones that transmit West Nile, they're primarily an urban mosquito, and they usually bite around dusk and dawn. So if you're out at those times, long sleeve, light colored clothing, wear your bug spray. And then for travelers, just be aware where you're going and see what's in that vicinity. Because a lot of times we find too, for you said, a lot of people that travel that are visiting family and friends, a lot of stuff shows when you're back there, because you're comfortable in that setting, you might not put on all the repellents and bug sprays that you would if you were, say, a tourist in an area that you don't know. So big thing is know where you're going and know what precautions you should take for that area.
What does a tick look like?
Depends on the tick, but the black-legged tick, the adult stage is about the size of a sesame seed, dark reddish brown. They're actually, the big thing people are surprised with is how small they are. They always think, when I show someone, a tick crawling on, they're like, oh, I didn't know it was that small. So the big thing is they're quite small. And in the summer months, which most people are out in the woods enjoying the outdoors, is when the nymphs are out. They'd be like the teenager stage. They're about the size of a poppy seed. So they're extremely small. So they're in your hairline, your armpit, other areas. It's really hard to notice them. So that's the big thing is when you're outside, try to stay in the middle of the trail. Don't go off into the brush where they're hanging out. And then that personal protection and doing those tick checks. And then if you are concerned, you think you had a tick on you, you're not feeling well, that's when you go to a physician and let them know you have possibly had an exposure.
And after you come out of the woods,
Do a
find a
tick check.
buddy and
Yep.
get naked. Yeah. I don't normally suggest that we turn our backs to the cameras here, but for 10 seconds here, everybody, turn around. What are we looking at on the big Jumbotron back here?
So that's an 80s albopictus. Or
That's
Asian
a
tiger.
what?
80s albopictus or the Asian tiger
That's the
mosquito.
Asian tiger one we talked about earlier. So Fiona, what's that going to do to us?
We know that it can transmit a number of viruses, but as I say, it needs to have people who are the reservoir of the particular virus to be able to bite that person first, to amplify the virus inside them, and then spit it out at the next blood meal on another human. Aedes albopictus will actually feed on other animals, not just humans, and so it could pick up an infection and then on the next meal bite a dog. And so that infection is lost, at least to humans. So it's not until we have the types of diseases that are amplified sufficiently in humans that are going to allow lots of humans with that disease for this mosquito to actually be a danger.
Ian, we are always trying to stay ahead of the next disaster, whether it's, obviously weather-related or bug-related or whatever related. Do you think this province is ready to deal with an epidemic of West Nile virus?
One of the things about things like West Nile is that you get a large number of cases where it's obvious that people are infected, but also a lot of the encephalitises, you get a large pool of people who don't show any symptoms. So one of the problems is, plus also a lot of the viral encephalitises look fairly similar. So one of the problems is if you start getting an epidemic, it takes a while before it's obvious just the number of people who are infected and what's really going on. The nice thing about viruses that are spread by things like mosquitoes, though, is that you can predict this is the time of year where you're going to see the spike. And you can predict back by looking at the spring and summer, how many mosquitoes are around. So it's not as if we don't have the tools, it's just that there's one more thing, on the list. And viral encephalitises are, below the radar until they're above the radar, I guess is the way to put it. So that we can control it, it's just a case of getting people out there and being vigilant and actually doing the legwork and realizing if we have a cool summer, you're going to put in the work, but you're not going to have the epidemic, so people will be a little disappointed.
How prepared do you think the healthcare system is for
We'll say we
this?
do actually have a pretty extensive, based on West Nile, but a pretty extensive mosquito surveillance program. So every health unit has mosquito traps that they actually place out over the summer and capture the mosquitoes. And we look at that on a weekly basis so we can see what species we have. We actually have them viral tested for West Nile, so we can see, how many are positive, when are they occurring, so that can kind of give us some indication of what the season's doing. And then depending on the health unit and where they are, some of them actually have mosquito control programs where they actually target the immature mosquitoes, where they put pesticides down in the catch basins to target the mosquitoes for West Nile. So small anecdotal thing, if you look at your catch basins out front and you see the little paint swatch on your catch basins, that means it was actually treated. So like big areas, because it's an urban issue for West Nile, so our big urban centers, they have control programs.
Now, I think a couple of minutes ago you said make sure you use repellent with DEET. Some folks are uncomfortable by having repellent with DEET.
Yeah, so
what do you say to them about
so
that?
the approved products that we usually see in Ontario is either DEET or Acardin. I've heard it said different ways. So those are the two main ones that we have. The main thing is just following the manufacturer's label. Usually you spray it more on your clothes than on your skin. You just read what the label tells you. But they've been used in Ontario for quite a long time, and they are good at repelling mosquitoes. So
And no health after effects.
everything has a different risk, but basically it's been used for a long time. And if you follow the manufacturer's label, and do what it says, you're pretty safe.
We also have DEET products now that are only 12%, 20%, 30%. In my day, we would get 95% DEET, So we don't
Serious
use
stuff.
we don't use that sort of concentration anymore.
So it's safe to use in your view.
In my view, it's safe to use.
Yeah, there's a trade-off there, though, in that if you have a lower concentration, it lasts for less time. So that if you have 95%, you put it on at night and it protects you all night. The problem is if it's 12%, you need to wake up every few hours and reapply it. So that, that's an issue potentially. You think you're protected, but you have to keep reapplying in order to keep the protection up.
So which way is better?
I personally would go for the 95%. Those
Yeah?
were the good old days.
Just put it on once and you're done. You're good for 12 hours.
Yeah, protects for a good long time. With the current ones, if you're sleeping outdoors, potentially you may need to wake up every 2 or 3 hours and reapply it in your days to sleep.
That's a personal level where you are and what you're doing. So for example, West Nile is an urban issue, but if you're up in northern Ontario, it may feel like the mosquitoes are carrying you away, but they're not transmitting West Nile there. So you're putting DEET more on just to reduce the nuisance of them versus a health risk. So those are big factors too. Or if you're, say, down the St. Lawrence region where there's lots of ticks and higher positivity rates, you may want to have a higher concentration to repel those ticks. And it just depends too on your comfort level, how often you feel like you want to reapply.
Do you think family docs know enough about this?
We are educating the family docs. Us with the Ministry of Health and Long-Term Care, we do have education programs. We actually do physician education events where we actually go out and teach physicians, this is a tick, this is what it looks like, this is where they are, signs and symptoms what to look for. So we are working with physicians and our colleagues to actually educate them on Lyme disease and West Nile.
And Fiona, let's finish up with you. Options for limiting the spread of everything that we've been talking about. What do you suggest?
I've heard people say that we should be, fogging to get rid of all the mosquitoes. I would be dead against that for the simple reason that there are so many mosquito species out there that are not pests, that don't transmit any diseases to us, and they're important in the ecosystem. So really, we have to figure out targeted control, find the species that are important, such as the Culex mosquitoes for West Nile, and the targeting is looking at the immature stages. Do it science-based and sensibly.
Good. I want to thank the three of you for coming in and helping us out with this tonight. Fiona Hunter from Brock University, Curtis Russell from Public Health Ontario, and Ian Crandall from the University of Toronto. Good job, everybody. Thanks so much.
Pleasure.
Help TVO create a better world through the power of learning. Visit TVO.org and make a tax-deductible donation today.